Good evening, everybody. Nice to have you here this evening. Thank you for obliging us and joining us on this, our walk, our talk on cancer. For those who already know me, my friends and colleagues and family members already know me. Well, I don't need to introduce myself, but to those who are joining via some other invite, my name is Toyo Idris, and I am the host of this August occasion. I'd like to say good evening, everyone, and welcome to Let's Talk Cancer, an initiative that was inspired by the loss of a very, very dear friend. In 1 week, between June 30th and July 5, I lost 3 people to the dreaded disease, including a 9-year-old. This knocked the wind out my sails, mostly due to the closeness to and with these people, 2 of whom I was involved in their care. The negative prognosis, the daily battles, the pain, the will to live, the love of family, the pain, and eventual loss to the disease. It was and still is harrowing for me as a friend and as a family member. Solace now is in the belief that they have all gone to rest and they are in a better place. So on August 7, the thought of making people more aware of this dreadful disease came to me. Ways to prevent it and to beat it was born in me. And I saw it as a way to honor my friend, who would have been 52 actually this month. I was hoping I would be able to do this on her birthday exactly, but unfortunately I couldn't. But here we are today. So this is my way of keeping her alive and asking all of us and wanting all of us to stay alive. I will be inviting my dear sister and friend, who is a medical doctor, and who is going to be the one sharing with us. Her name is Dr. Bola Tayo. I would like to read a little bit about her profile so we understand where she's coming from, what her background is. Dr. Bola Tayo is a pharmaceutical physician currently working with Ipsen Pharmaceuticals, a multinational pharmaceutical company with UK offices in Didcot, Slough, and Wrexham. She qualified as a medical doctor from the College of Medicine, University of Ibadan in February 1997. And in 1999, she enrolled into a specialty training program in clinical radiology at the UCH Ibadan, where she became a senior radiology registrar before leaving Nigeria for the UK in 2002. She commenced a UK medical practice initially in the emergency medicine specialty, where she worked her way up to staff grade doctor level in 2007. A change in career focus took her into the pharmaceutical industry in 2009 after she had her second child, and from then she has since worked in clinical drug development with 3 different pharmaceutical companies in the UK. Dr. Tayo is Dr. Tayo is well versed in the meticulously regulated drug enforcement industry, right from when candidates' compounds exit the animal testing phase to the point of approval for use in humans by the appropriate regulatory authorities. She has worked across a wide range of therapeutic areas, helping to ensure these new medicines are safe and ethically tested in human volunteers, thus bringing these medicines to market to fulfill several unmet medical needs. Dr. Tayo enjoys the fascinating but painstaking process of planning and conduct of clinical trials, taking time to ensure the matrix working environment is maximized to bring out people's potentials. She takes pride in knowing her ex-hospital clinical work brings much needed interventions to a greater number of people worldwide, compared with being in the hospital treating only a few patients at a time. Her long-term goal is to set up a clinical research training center in Nigeria, where clinically oriented personnel can be trained to plan and ethically conduct clinical research for drug development, utilizing strategies that meet international standards. Dr. Bolanle Tayo is married to Mr. Tunde Tayo, and they are blessed with 2 lovely children. She's an ardent fan of crime drama and a music lover in her spare time. Music is her comfort zone. But before I call Dr. Bolanle Tayo to start her presentation, I would like to lay some few engagement rules for today. You'll notice that everybody is on mute. Please, so that we'll have one house at a time. We don't have everybody talking at the same time. And I know that by the time Dr. Tayo is done with her presentation, we'll have a lot of questions. Even as she goes on with the presentation, I'm sure we'll have questions. I would suggest and advise that we put them in the chat room. And all these questions will be taken at a go. Once she's done, we'll take them in blocks, depending on the number of questions we have. And then we'll have her talk through all those questions. I would like to thank you once again for tuning in. Let's hope by the time we're done this evening, we'll have learned a thing or two from what she's about to share with us. And probably what I would have to say too about my experience with cancer, with people living and who eventually passed on with cancer. So thank you very much. I'd like to call on Dr. Bolanle Tayo to please present what she's got for us. Thank you, everybody.
Thank you very much,
Dr. Tayo.
Yeah, thank you very much, Sister Toyosi. And first, I'll say thank you to you for actually having me in mind and inviting me to be the speaker on this August occasion, which is thankfully happening in August. I jumped on the invitation actually because I do have personal experience with cancer also, because my father, he passed on about 7-8 years now, following a diagnosis of cancer of the stomach. So it's, I've lived it also. And it is something that every one of us here would have touched us in one way or the other. So I'm hoping to just kind of pass across messages today that we have all heard, but probably, with the day-to-day activities of life, those messages kind of have flown past our consciousness, but I want to bring them back to our consciousness so that we can be quite conversant and familiar with what cancer is all about, its impact, how to know if something in our body is developing its cancer, and things like that. I'm not here to lecture us, so I would like, to first of all lay that foundation. Yes, I'm a medical doctor, but I know there are also medical doctors on this call and people who from different backgrounds. Everybody is an expert in their own field, but I'm only here to share. And as my sister said, questions, if you have your questions, drop them in the chat box. We will attend to them later on. I think one thing we need to also mention is that this is being recorded. So if anybody is not comfortable with that, well, unfortunately, you will, I think the recording actually just comes on by itself. Isn't that what happened, Sister Toyo? It's not like you started it.
Yes, Zoom actually records as well.
Exactly. So I think it's almost automatic now. Once the call starts, it starts to record. So unless we switch it off. So if anybody is not comfortable with that, please do let us know. But I'm hoping that everybody's comfortable with that because of, obviously the regulations here and there in different parts of the world. So again, good evening, good afternoon. I know people are dialing in from different zones. The presentation, I will try to be as quick and, whiz through it, but, please keep in mind your questions. And yeah, here we go. I'm going to try and share the screen now, and I need to be able to, I need for us all to be able to tell me if we are seeing the screen. If anybody is not seeing the screen, do mention it in the chat box for Sister Toyo to see. But if you can, I will just crack on. So we're going to talk about cancer today. We're going to look at some of the myths or kind of false information around cancer. We will look at facts around cancer. We'll look at how we can detect it and the therapy modalities that are available for cancer, as well as the care that is required for anybody that has been given a diagnosis of cancer. So this, as Sister Toyo said, is in memory of those we have lost to cancer. And the initial preamble that I want to share with everybody is just this, and that is the fact that knowledge is power. When we know the truth, it sets us free. I'm not going to go scriptural on us, but basically, when you know what to do,
Hello, Polanyi, we can't hear you. Okay.
can you hear me now? Okay. Apologies about that. So again, I'm just going to go over this particular slide. I think I'll just leave it in this format. I won't go into the presentation mode because I think maybe that's the reason why I lost the audio. So I'll leave it here. So again, going over this particular first slide, I was saying that knowledge is power. And when I was in medical school, one of the things that we were taught generally about, life and being able to be a medical doctor is that we need to look at how people go about their lives.
Sorry, Dr. Payo. Sorry, you can do the full screen.
Okay.
That's why I couldn't hear you. So it's been taken off you now. So
okay.
Thank you.
Okay. So going back to KABP again, as I said earlier on, while I was on mute, sorry. The KABP there is essentially talking about knowledge, our attitude, our beliefs, and our practices. What we know influences our attitude about what we know about life. And our attitude eventually then trickle down into what we believe. And then this in turn influences our practices, the things we do. So if I know about cancer, I know that, okay, cancer can strike anyone, as we will hear about later on. It can affect anyone. It can be prevented in some cases. I know about the signs and symptoms of cancer. I know what to do should I start to experience any of the signs and symptoms, and then I will be able to manage it. And then I will not hold on to erroneous beliefs about cancer being maybe a curse or it's somebody that's sending cancer to me. My beliefs will be more oriented towards finding a solution rather than, dwelling on what caused the cancer. And obviously from that, my practices, the things that I do about cancer or any other aspect of life will then be as a result of my knowledge, my attitude, and my beliefs. So this is something that I kind of took away from medical school way back then. And having the right information is key to making right decisions. So exactly what I just said now. If I don't have the right information, I will do the wrong things. I will decide, I will take the wrong decisions. And obviously this will have an impact further down the line, God forbid, should anything happen. And I have this picture I stole from somebody's WhatsApp status a few days ago, not knowing that it was going to come in handy today. We have here 5 horsemen. The first four we all know are the ones that are causing central problem in the world. There's war, famine, pestilence, and ultimately death. But we have a fifth horseman right now that is really raging and going around the whole world. And that is called, this fifth horseman is misinformation. There's a lot of fake news, fake false information out there, and it is really it is a scourge right now. And I'm hoping that at the end of this session, I would have been able to dispel any false information that we might hold about cancer and everything about cancer. I'm not here to lecture again, so please let us bear this in mind. So what is cancer? Essentially, cancer is just cells in the body that's just gone totally berserk. They lost all respect for the body system, and so therefore they grow uncontrollably. The body systems that control them have lost control on them, and so they grow, and they are able to spread to as anywhere in the body. When cancer cells in the body spread, that is what we call, in medical terms, it's metastasis, or we say mets. Mets, the patient has mets in the brain or in the bone or the spine, that sort of thing. And what causes it, no one really knows. It can start almost anywhere in the human body. And so any body part can be affected by cancer, which is why, as of up till now, some books will say there are about 100 different types of cancers. Some I've even read in some cases, they say there are about 200 different types of cancers. And I'm like, hey, in one human body, you can have 200 different types of cancers. It is amazing. But yeah, there we have it. We need to differentiate between cancer, which is more of malignant, as opposed to benign tumors, because benign tumors, as the word says, are benign. They're not, they're not necessarily dangerous, but at times you can have a benign tumor in a particular location in the body that is causing, and some havoc. So in which case, such a tumor, a benign tumor, will need to be treated. I mean, there's some benign tumors, fibromas, lipomas. Those are benign kind of tumors. Lipoma is a fat collection somewhere in the body. A lot of the time, doctors will say, if it's not troubling you, if it's not giving you any symptoms, not causing anything, just leave it. If it ain't broke, don't fix it. That's the motto with benign tumors. But of course, they still need evaluation. They need appropriate diagnosis, and if necessary, they need to be treated. But they're different from cancers, which are definitely malignant. And the sad thing is that cancer can occur in any age group, and so no one is spared, young or old, male or female. It does not respect anybody, just like COVID, actually. So I would like to bust some, I'm the myth buster for today. I would like to bust some common myths about cancer. I mean, these are things that people kind of spread around that I really would, I'm hoping we can all kind of drop today, after this talk. One of them is that cancer is always genetic. It is not always genetic. Some cancers are linked to certain genes, in which case you can have, people in, different generations of a family actually having cancer. Breast cancer is one of them. And so that can happen, but it's not always genetic. Actually, most cancers are, as a result of environmental factors, either from the outside or from, or factors that affect the inner part of our bodies. We also hear people say, oh, cancer is infectious or contagious. Actually, I've not heard this being said, in a very long time. But I remember when I was growing up, before I became a doctor, I used to think that, oh, maybe, you could catch cancer from somebody else. It is really not true. However, the aspect of cancer that is linked to infection sometimes is that some types of infections can predispose people to developing cancers. I think the most common one that I know of is the human papilloma virus infection, the HPV virus, which is commonly linked to cervical cancer as well as oral cancer. And in developed countries, there are vaccination programs that are offered to youths, both boys and girls, actually, against the HPV virus. And so that's something that is maybe where people have got the idea that cancer could be contagious, but it is ordinarily not contagious, please. Another untruth is that eating sugary foods makes cancer worse. Yes, we all know sugar is a culprit. Over the years, it has been proven that consumption of sugar is not good for the human body because sugar is a very strong oxidant. And so you definitely don't want too much sugar in your system. But to say that eating sugary foods makes cancer worse, or because, cancer is supposed to be feeding off the sugar, there is no scientific basis to this at the moment, unless maybe further down the line somebody comes up with a theory that is proven to be true. But as of now, it's not a truth. Also, and this one is a sensitive one. The impression is that once you've given a cancer diagnosis, it is an immediate death sentence. I'm happy to be able to say that it is not always the case. Yes, it's not good news. It's probably one of the worst news that any physician, any healthcare practitioner can break to a patient. I think it is, apart from COVID. But thankfully, COVID is not even that bad. Being told that you have cancer is actually a life-changing diagnosis, but it is not an immediate death sentence. I'll talk a bit further about this later on, but I think we just need to take it on board that it is not an immediate death sentence. We also need to kind of move away from a particular school of thought nowadays. Okay, so with social media, because I've noticed this personally, on social media everywhere, you have all these posts about people being positive, maintaining a positive outlook to life. Oh, you have to be thinking positive all the time, and that thinking positive enhances your health, you're healthier. Yes, it is true, all of that. But let's drill down to the basic facts. Somebody who has been diagnosed with cancer, there's just no way they're going to be happy every day. Even me, God forbid, all of us, we're not happy every day. We can't go around smiling every day. But we just, kind of trudge along, hoping that everything will be fine. Now, placing the burden on somebody who's got cancer and telling them, oh, you need to keep positive, actually is not, for me, it's counterproductive. Because, we're telling them, oh, if you don't keep a positive outlook on life, you will not get better, or your prognosis will not improve. I think it's not fair. So it's something we need to kind of move away from doing. Let them have their moments, but be there for them. Just as my sister was there for her, friend and other loved ones who passed on. Be there with them, hold their hands, physically or mentally. If they have rough moments, let them know that yes, they're allowed to have those rough moments, but they will come out of it. So this one is actually quite close to my heart. Another thought that goes around is that if you live close to power lines, you're at risk of developing cancer, or if you use cell phones, you're at risk of developing cancers. No, there is no scientific basis or background to this either. Yes, in the past, cell phones, mobile phones especially, I don't think they were so highly regulated in terms of radiation that they were emitting or are emitting. But now they're well policed, well regulated. So I really don't see, a link between usage of cell phones or living near power grid pylons. I don't see any link or causality link between them. Another one which kind of tickled me when I, read about it was that some people think that when you expose cancer lesions to air, you're actually going to make it worse. I don't know where this came from, but I am just here to try and tell us that it really doesn't make any difference. So let's not, go down the line of thinking like this. Another one is that the usage of deodorants and antiperspirants. Yes, I heard actually sometimes somebody saying, oh, I don't use X brand of perspirants and deodorant because they contain carcinogenic things. I can't say, but I do know that they wouldn't be on the market, so much if they really were linked to cancer. I don't see there is any scientific basis to it. And so I don't think it's something we need to worry ourselves about. But of course, some people like to go the extra mile and say they're using eco-friendly product. Fine, I wouldn't stop anybody from doing that. And one final one that I would, bring to um, our attention is herbal remedies. Yes, there are lots of herbal remedies out there. I particularly don't use herbal remedies. I'm just somebody that's very funny. I don't know that I don't believe in them, but they are, I'd rather just, wear the things. But herbal remedies, I don't see, I don't see them being a cure for cancer. Not yet. Maybe in the future, but as of now, not yet. So we need to just, be careful the kind of information we share with people, because again, knowledge is power. And so I'll now move on to some factual commentary about cancer. Again, as I said earlier on, cancer can affect anyone. It does not respect anybody. Most of them are secondary to external factors like lifestyle choices, diet, pollutants. Some are genetic. The exact mechanism is not yet known. Lots of theories exist. And, I was reading that on an average, on the average, every year, about 14 million people are diagnosed with cancer. And what really struck me is the fact that most of this 14 million, majority of them are, the diagnosis is actually made in developing countries. I don't know how come, and this was a, definitely a peer-reviewed journal I was reading. I used to think that, oh, most cancers are actually in the developing world, but maybe because of advancement in technology, cancer is being prevented more in the developing world, and so in the developed countries as opposed to the developing and less privileged countries. But yeah, this is what we have. And so the onus is on us, especially people who are, in developing countries. We just need to be more conscious of our diet, of our lifestyle, and basically take, good choices and make good choices. Cancer is said to be the second leading cause of death globally. And the last stats, at least that I looked at, said about 8.8 million people, nearly 9 million people, passed away as a result of cancer in 2015. That's about 1 in 6 deaths, which is a real high percentage, that can be attributed to one disease condition. 5-year survival rate. So basically, survival rates of cancer is measured in 5 years. And what it is they will measure, or they will count the number of people that live up to 5 years and beyond for every type of cancer. And that's what you call the 5-year survival rate. These rates actually are getting better. Over the years, with advancements in technology, in treatment modalities, the rates are getting better. So yeah, this is good news. But honestly, prevention is better than cure. That's all I would say. The common types of cancers that we have differ between the two sexes. So for women, the breast, colorectal, the lung, the cervical, and thyroid cancers are the more common ones. Whereas in men, we have lung, prostate, colorectal, stomach, and liver being more common. So we can see that in both sexes, lung and colorectal cancers are kind of more common, they're common to both sexes. And, I keep harping on about this, but this is what is relevant here. This is why Sister Toyo brought this up, because she experienced cancer. She lived through it in Nigeria, and she was able to see that in a country like Nigeria, cancer care is just almost non-existent. Both the care that people can offer the patients at home and care in institutions is almost non-existent. And why? Because the health system in countries like Nigeria is basically it's fledgling. It's in a neonatal stage. That's all I would say. It's almost non-existent. And of course, this has an impact on the outcome, the diagnosis, and end results of a cancer diagnosis in Nigeria, as an example, is often not very good unless you're really very, very rich and you can travel out, which is unfortunate. But when you compare, the outcomes in developed countries, where better health systems exist, of course, the outcomes are, you can't just put them beside one another, unfortunately. And so again, it all boils down to us knowing what cancer is about and knowing what to do if we actually get wind of it coming around. So we're going to talk about the detection of cancer. How do we detect it? How do we know if things are going amiss in our systems? The first thing I would say is that the earlier detection activities are embarked upon, the better the outcome. You don't want to be diagnosing cancer in stage 3 and 4. Cancer is divided into 4 stages in terms of how gone it is. Stages 1 to 4 are what we have. So if you catch a cancer in fact, there are some earlier stages before stage 1. If you're able to catch a cancer in those stages, the precursor stages to stage 1 and stage 1, and maybe a little bit of stage 2, you're fine most times if you get treated very aggressively, with the appropriate kind of treatment. The outcome can be good. But if you're diagnosing cancer in stages 3 and 4, really quite poor prognosis or poor outcome. Self-examination, I talked about this earlier on, so I'm not going to go into depth again, but it's all about us doing these things. It's not just about knowing this, it's about actually putting it into action. Self-examination, being aware of changes in our body, little things like a wart on your skin that suddenly starts bleeding. You've had this wart on your skin for so long, nothing happened to it. All of a sudden it starts bleeding and crossing over. It's getting bigger, it's getting painful. You need to get it sorted because those could be potential precursor signs of that particular lesion, that wart you've had in your body for so long. It could just be undergoing changes that you don't want. So those are the things that I want us to take home from here. Detection activities actually, ideally in a sane environment, sane being the operative word here, they're undertaken by governmental authorities. The government and whoever is in charge, they will set up appropriate detection programs. But as individuals, if we don't take up these detection programs, if we don't go in to utilize them, they're useless. So it's kind of like a two-way street. The programs exist, people need to go in and make use of the programs. Otherwise, they're just going to be there. So detection essentially covers, it's split into 2. You have the screening, which is the earlier part. Then you actually have the early diagnostic testing that can be done. Screening programs are very important because they can pick up the disease at the asymptomatic state, even before patients start to have the symptoms. You can actually, detect it, if the person or if the patients are taken through the appropriate screening programs. Whereas early detection programs are, they're very important and pivotal for diagnosing the disease when it's in early stage, as I said, maybe stage 1 or 2. And both of them work hand in hand. But I will talk about the subtle differences between them in further slides. As I mentioned earlier on, survival rates will depend on detection activities. The earlier you do it, as I said in the very first point there, the better the outcome. And of course, this goes without saying, I've said this and I keep banging on about it. Developing nations, they record lower detection rates compared with developed countries. It's just what it is. Until we get our act together in, developing countries, this is how it's going to be. Apologies about this. I'll move on to the next slide. So talking about detection a bit more, this kind of just breaks down everything I've said in the previous slide. I've given examples of screening programs here. We have the pap smear, you have colonoscopy programs, you have mammograms, you have bioassays for CA125 in the blood system, you have alpha fetoprotein. The CA125 is basically for testicular tumors, whereas alpha fetoprotein is more for liver tumors, is more specific for liver tumors. So all these kind of programs are available in, in different places, and people need to be aware of them and make use of them. And screening programs, what they do is that they focus on entire target populations. So they're not just looking at individual patients, but they would potentially bring in, let's say, if it's a pap smear, they'll bring in women of a certain age. Usually they're sexually active women up to a certain age who still have their uterus and their cervix, and they bring them in to have the smear. Colonoscopy will look at people from about 45 or 50 upwards, bearing in mind that colon cancer is more common in older people. Not that it doesn't happen or develop in younger people, but it's more common. So in environments where colonoscopy is part of the screening program, from around 50, people get invited in to come and have it done. And if there's positive family history of colon cancer in the family, some people actually would be brought in even earlier than 50 years old. So these are some of the programs that can be, screening programs that can be undertaken. And as I said, it comes before early diagnosis and usually is more of a routine procedure as opposed to it being a specific, as opposed to specific tests that early diagnostic tests actually are. For early diagnosis, it's a combination of these 3 points that I've highlighted here. People need to be aware of cancer symptoms, and they need to then know where to go to access care should they have any diagnosis of cancer. They want to have somebody who's going to be able to take a good clinical evaluation, take a good history from them, examine them properly, make the correct diagnosis, because we've had wrong diagnosis before in some people, when maybe their samples have been mixed up. So you want to go to a center where they will make their diagnosis, and the diagnosis will be your diagnosis and not somebody else's. And then you want somewhere that they can do the staging of the cancer appropriately, because the different cancer stages, as I said earlier, on 1 to 4, the treatment that will be offered to a stage 1 cancer will be different from what will be offered to a stage 4 cancer. So you want to be in the hands of somebody who knows what they're doing. And that's what early diagnosis, really offers people. And of course, a very important aspect of cancer care is pain relief, because at the end of it all, cancer brings pain a lot of the time. A lot of cancer patients end up in massive pain, and it can be so distressing, not only to the cancer patient, but even to their family members, their loved ones who are watching them to be in pain. And so access to pain relief is very important in the detection. So we now move to cancer therapy. And basically this is all about, taking care of somebody who's been diagnosed with cancer. It is a multidisciplinary activity. It will involve so many different disciplines. You have surgeons, you have internal physicians, you have radiotherapists, you have radiologists, you have physiotherapists, you may have speech therapists, you may have, cognitive behavioral therapists. So many different disciplines are involved in the care of somebody who's got cancer. Here in the UK, we also have people, nursing personnel who are trained to look after cancer patients. They're called Macmillan nurses, and they're specialists in the care of people who are living with cancer. And the exact methodology and modality of the therapy that will be offered will depend on the type of the tumor, the stage, and the clinical features. Cancer therapy is often very expensive. I don't want to think about it, but it's so expensive that I just tell myself, I'd rather prevent, cancer than have to treat it further down the line. So this here is where that axiom, prevention is better than cure, really, really, really is suitable. And again, I'm emphasizing the pain relief aspect. The mainstay of cancer therapy, I've mentioned it earlier on, surgery, chemotherapy, as well as radiotherapy. You can have them being administered in isolation, depending on what kind of cancer you're talking about. Or sometimes, most times actually, you have to combine it. Sometimes you combine chemotherapy with radiotherapy. So the patient will have chemotherapy first and then maybe go for radiotherapy later on. So you get that kind of combination being offered to patients. In a sane environment, I keep stressing that also, the choice of the treatment is actually something that the patient needs to buy into. They need to agree to have this kind of treatment. But obviously, you as the caregiver also You need to offer them what is appropriate and what is suitable for their cancer, for the type of cancer they have. Now, another factor that then comes into play is the cost, which I mentioned earlier on. So if a patient cannot afford a particular kind of care, this really puts them at a higher risk of increased morbidity and potentially mortality. So it's something that we just need to try and get in the system, that preventing this is our best option. However, sometimes we just draw the short straw in life, and we cannot control cancer if it's going to develop. One last point on the overall cancer therapy, cancer of cancer, is that we have what we call end of life care, which is called palliative care. Palliative care essentially is offered to patients when we know that there isn't much more we can do for them. They've reached the end of their lives. And all you want to do is just make the end comfortable for them. You want them to be comfortable, to be pain free. And so that kind of care is what is offered in what we call hospices. But for those who are lucky, who may go into remission, you then also offer them what we call survivorship care. That is, they are survivors of cancer. Um, but the thing is, the onslaught of cancer on them, having to go through 3 treatments and all that, a lot of people come out, they really are, it's like they're disengaged from the world. So you need to actually rehabilitate them. And so that is part of cancer care also. It's really very, very important. And family members, especially in a setting like Nigeria, family members are really very important in being able to help cancer survivors reintegrate and get rehabilitated back into a stage where they can actually get back to life and living like the rest of us. And so this final, I think this is the semi-final slide. This just talks essentially about the types of care that are available, or treatments that are available for cancer, again, surgery, chemotherapy, radiotherapy. Uh, the approach to cancer care, if you talk to the actual specialist, I'm not a specialist, but yes, I know about it. People who are specialists in cancer care, they will tell you that it's a holistic approach that is, advised uh, to be taken when managing someone with cancer. The mental aspect of it is really very important. A lot of us just think it's the physical aspect and all that, but the mental effect of being diagnosed with cancer, undergoing all these different modalities of treatment, chemotherapy can be absolutely debilitating on the body. I have not undergone it, but I've been, with people who have undergone it. Same thing goes with radiotherapy. People lose their hair, they lose their self-confidence, they just basically feel crap. And so, when they are surrounded by their family, by their loved ones, it helps a lot. It helps a lot. And, it's really, really helpful towards getting them to recover quickly, for those who are fortunate enough to go into remission. Again, pain care, very important. Palliative care, very important. And rehabilitation. So this is just basically going over some of the stuff I've said in earlier slides. And I will not go through this slide again because it's a bit repetitive, but it's just for me, I like to emphasize different, the various things that really are pivotal and very important. Cancer is common, it's non-discriminatory. If I asked people now to indicate by a show of waving their hands in the chat box, if there is anybody whose life has not been touched by cancer, I'm pretty sure there's no one who will be, will raise up their hand, because it is so common. But it's a good thing, because we have to, remind ourselves it is not always a death sentence, an immediate death sentence. I will caveat this, however, by saying that it depends on where the patient lives and their social status. It's unfortunate, As we said, cancer care is expensive. So, you know, those two things actually can actually make it a death sentence if somebody is diagnosed with it. If you're not well off and where you are geographically in the world, that those two things can actually be deal breakers. 1 in 6 people die of it globally, and it's something that we just need to understand that while some are genetic, it's not all of them. Majority are actually due to environmental factors. Prevention is better than cure. If you believe in prayers, please pray. Do not underestimate the power of regular screening and regular screening tests and early diagnostic tests. These things save lives. Catching it early is really one of the best things to do, So I am here asking every one of us here to please, 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 let's not take these things for granted. If we're in an environment where they are available, make use of them. If they're not available in where you live, but there are, private facilities for you to, go in for screening tests, don't pass them by. Do not pass them by. That is the message I am here to take, to pass across to us all. The therapy is multidisciplinary. It's expensive, but when started early, often yields very good results. And one final point that myself and Sister Toyo were laughing about was the village people aspect. The village people, our village people have been maligned a lot. Everybody, any little thing, your village people are after you. Your village people are after you. Village people, we are sorry you are not the ones behind this. We are the ones who should take, the initiative to be more vigilant, to arm ourselves with, correct information, concise knowledge and information, and take up whatever facilities are available. And with this, I think we can all kind of move on to a higher level of consciousness about cancer, and not just have it in the periphery of our sort of consciousness. Because if you've not lived through it, you really don't know what it is all about. So for those who have lived through it, they know. But sometimes we can also forget, even those of us that have lived through cancer, somebody in your family, having cancer, we can sometimes forget. So we're here, this is why this initiative was birthed, following the unfortunate incidents. That is why we're here. And I'm hoping that with this little presentation, we've all taken away something really important. And if we have questions, please kindly drop them in the chat box. I am here at your service. Thank you very much for listening. I hope I have not bored anybody.
Thank you so much, Dr. Tai.
I'm going to stop sharing now. You need to come off mute, Sister Toyo.
Okay. Thank you, Balani. Thank you so much. Thank you. That was a well put together presentation. The essence of us gathering today is for us to have a general overview of the disease, which is what you've been able to pass across. And I hope everyone has one thing or the other to take away from what she has said. And like she said, if you have questions, you can drop them in the chat room. We'll take them one after the other. I see some questions coming. But I'd like to add a few words to what she has said. Just like she said, I have lived it, and I lived it not too long ago. And when I say not too long, I'm just talking a couple of weeks ago. And talking about it now, I'm still having goosebumps, and I'm sure I'll still have the goosebumps for a very, very long time. I think my living with it really started about a year ago. Funny enough, it started in August last year when I had like a little niece who was diagnosed with cancer. And there's some things that Dr. Tyre just mentioned about early detection and all of that. And I found out that this part of the world, is either we don't take things seriously, our medical practitioners don't take things seriously, or because of the way the health system in the country is, in quotes, they tend to do as they please and they get away with it. Why am I saying this? For my little niece, she died at 9. She was just a 9-year-old. So, I mean, you can, and she went through this for, I think the period of the illness or the disease was about 2 to 3 years. And the poor girl, it's not easy to relieve, you know. And she actually did scans, just like Dr. Tyre said. I mean, they need to do some, I don't know what she called it now. I can't remember what she called it. She said there are 2 types of way to check. There's the one that checks for cancer and stuff, and then the one after they've diagnosed or something. And before he was diagnosed as cancer, it took almost 2 years of the poor kid going in and out of hospital. Did all the checks and everything. And there was this particular scan that was done. And the disease was there. They could see it there. But the radio, sorry, I'm not a clinical or medical person. I don't know the terms really. Wrote all clear on that scan. That was in 2018. My little baby passed on June 30th this year. And at that time, nobody knew what was going on. She was in and out of hospital. It was a harrowing period. Only for her to be taken out of the country, she ended up in South Africa. And the scans, all the documents, and everything was taken when they were traveling. And in that stuff, in that the scan and all, the doctors, the oncologists that she saw in Africa eventually told the mom who traveled with the baby that here is the tumor. Why didn't they take it out? The scan where the tumor was discovered was in 2018, and the kid died June 30th, 2020. So where am I going with all of this? When we do go for all these tests and scans and everything, let's check and check again and have a second opinion and a third opinion when we can. And like Dr. Tyre said, for some people, they can't even afford the expense of taking care of this terrible disease. Anyway, what brought about my wanting to have this talk was actually losing a friend as well. And a friend that was very, very dear to me. And I was involved in her day-to-day as well. So it's very painful when you see that medical practitioners don't put in the best to getting us better here in the country. So I don't know. And then another part that I feel is quite important is the love and care from family members and people around. Although I know that a lot of us try to keep it quiet. We don't want people to know for one reason or the other. But the attention that comes from the family, from your loved ones, is very, very, very critical. And especially when it's practically terminal. We don't discover these things early. It's always late by the time we're in on it. And then the person has just a few months to go. So the attention, the care, the love that we give to them is very, very important. And please, I'm talking to myself as well. Please, let's check ourselves over and over. There's a particular stage we get to, especially we women. When I was getting the death certificate for one of the people that passed on,
just to tell you how much I was involved in all of this. And the doctor that wrote the certificate told me that he lost his mom at 52. And it was cancer. And what he has realized is that we women, we don't take care of ourselves. We don't look after ourselves. We just keep going until we drop dead. That was exactly what happened to his mom. And that if we do a regular test, I'm using his words, I said, Madam, have you done, to be quite honest, I've never done all the things that Dr. Tayo mentioned. I've never done. I will not lie. It's wrong. At over 50, it is wrong not to do that. So I'll agree with her that we need to do these checks often. So this doctor now told me and said, Madam, when you do this test often, whatever it is that comes up, you only know it only started the year you are in. If you do it like every year, there's certain tests that we're supposed to do yearly. Dr. Sai, correct me if I'm wrong. There's certain things we need to do regularly. So if we do that regularly, we'll be able to pick up this ailment before it becomes a full-blown disease. So please, ladies, I beg you, implore you to please do your checks regularly, and please let us stay alive. Let us be there for the best times with our children, because I'm sure most of us are locked on here and not kids anymore. I'm sure we're from 30 years and above. Please, let us take care of ourselves so that on that day when our kids are having that special day of theirs, a minute silence is not set for us. Please, ladies. Thank you so much. I will take the questions now. Dr. Tayo, do you have your hands up or something? You want to say something? Oh, you're mute. Sorry. So sorry about that. I'll unmute you now. Sorry about that. I had to do that so that there won't be too many, we won't have interferences. I'm looking for you. I can't find you, Dr. Tayo. I can unmute you. I'm sorry. Just a moment. Where are you? I can't see you. Ask to unmute. Oh, well, I can't see you. Okay, there you are. I think you can talk now. You're still not. Dr. Tayo. Okay. Okay. Oh, sorry, oh, mommy. I'm not getting a hang of unmuting you.
Sorry.
I think I did unmute you. I did.